So we are very, so that was an excellent surgery. That was a great start to our live surgical session by Professor Nahani. And we move on to the second surgeon, Dr. Sonu Goel, who all of you know is a very prolific and excellent surgeon from Jaipur. These are the patient details.
So the patient is a 65-year-old lady, will be operating
5.25. Sir, exercise क्या है आपका?
Lens cataract of NS grade 3, posterior subcapsular component. The
20.
posterior examination and macular OCT is normal. The endothelial cell count is low normal of 2043. And the lens of choice here is the geometric toric. So the astigmatism as per IOL Master 700 is 1.31 diopters at 16 degrees. And as per the toric calculation, they are going with 1.56 corneal astigmatism at 12 degrees. So that would be the angle of implantation. Over to you, sir.
So am I audible, Somshila?
Yes, so you're very audible.
Yeah. Is the video clear? Am I central? Is the glow clear?
Yeah, it's perfect.
Perfect. Okay.
Yeah, so, red glow is better now. You have focused it very well. Is it a toric IOL?
Yeah. So this is a geometric toric that I'll be implanting, and as has been described, the placement axis is at 12 degrees and my incision is at 20 degrees. So at the outset, I'd like to thank Dr. Partha Biswas, Moradipa ma'am, team Trenetralaya. Excellent hospitality and the warmth that they have is amazing. So let me all welcome you all to this wonderful Hoya session. And I think I should congratulate Dr. Partha Biswas for launching Hoya for the East. I think the two important portfolios that Hoya was missing worldwide was their modified monofocal IOLs and their trifocal range of IOLs. And I think with the launch of this geometric and geometric plus lenses and again of the Impress, I think their basket gets completed where we have now this wonderful trifocal technology and with that paired approach. And as I keep on cruising through my surgery, I'll keep on describing what I really actually mean by the paired approach. So this is the Zeiss Calisto system that I'm using, and I'm using the Signature Pro from Johnson & Johnson. So I must congratulate Dr. Partha for having the world's finest armamentarium and the tools in his OR, and the team is amazing. I mean, you just need to put your hand out and you have the equipments there.
Which image guidance system are you using?
Yeah. So I am using the Zeiss microscope, and we have this Calisto system hooked onto the Zeiss, and I am using the Signature Pro, the phaco machine from Johnson & Johnson. So as you see here, the image guided system is giving me 2 side port incisions, and what I plan is, I'm doing under topical anesthesia. I would do 2 side port, 1.1 on either side. I use this wonderful angulated side port blades. So I'm a great admirer of this Phenocane and Phenocane Plus, no proprietary interest, but yes, this works really very good. Viscoelastic. So the viscoelastic is the next to go.
Sonu, anything on the viscoelastic? Do you prefer one over the other?
Yeah, so it's an individual choice because we do a high volume, so HPMC works very well in our hands. But yes, very specifically in those patients where actually you have high intralenticular pressures, I would always recommend using a high density viscoelastic. And so this is the Rexes that we initiate. I'm using the Catalyst platform more often, so Rexes should be very well centered in all these premium patients. So whenever you're dealing the premium patients, I think the effective lens positioning is very, very important. And to begin with, the very important key factor is a round, regular, well-centered Rexes. And I am a great admirer of polishing. Flush karte jao, saline dalte jao. So I would always polish the undersurface of the anterior and snugly the posterior capsule as well. So I think we could actually achieve flush. Back for Sandhu. Flush. Blood नहीं दिखना चाहिए. Flush. So I initially scratch and then use a 2.2 here. On the slit lamp, I was able to make some kind of a posterior capsular defect and wanted an OCT, but the OCT image was not very clear, so I'll be a little cautious while I'm doing the hydro dissection. So instead of dissection, I would prefer doing a delineation and viscoelastic. So Hoya geometric is basically a hydrophobic lens, and the whole concept with which Hoya got this geometric was a paired approach where they have a lens which is very good for distance, good for intermediate, and good for near, and the other, the geometric plus, which actually is very good for distance, very good for near, excellent for near. So a paired approach is what basically is a kind of a customizable solution. So here I just go in and try to do a direct chop here and split the nucleus into two. Am I clear there? Is the video clear?
Yes, it's excellent, Sonu.
Very much.
We are quite enthralled by
We are
the discussion.
missing Somashila. Are you there?
Yes, it's very clear, Sonu. We saw a beautiful direct chop from you, and we were listening to the discussion on the geometric IOL.
So, Signature Pro here again, on the fly, you can actually switch between the peristaltic and the venturi. I'm a great fan of this machine. And see the holding, the chamber stability, I think it works amazing. So when we are talking of the trifocal platform, I think the customizable approach is very good, because when you are dealing with the patient, what I now routinely in my practice do is take the patient first eye, do a geometric in one eye, and then talk to the patient. If the patient is a little dissatisfied for near, I would then shift this patient other eye to geometric plus. So for most of the audience, since this might sound new, geometric is basically a trifocal IOL where it gives an addition of around 1.75 for intermediate and around 3.5 for near vision. It is very good for distance, very good for intermediate, and good for near. And the second lens is what is called as the geometric plus, which is, as I said, is good for distance, good for intermediate, but is again excellent for near. So paired approach here means for people who after doing one eye feel a little discomfort for the near, you can then shift the other eye of the patient to what is called as the geometric plus lens. And if the patient is quite happy, patient is active driving, you can, have geometric in both the eyes. So the light distribution, if you see for both the lenses, for geometric, it's close to around 58% for distance, 17 for intermediate, and around 27 for near. So at this point of time, I would just slow down my parameters. Can you reduce the vacuum here? Yeah. So for the beginners, I think this is very important, because when you're taking or gulping the last piece, you have to be very, very careful. The bottle height, the parameter, the vacuum, the parameters go down, and you have to be careful. I see something there on the posterior capsule. I think it's not a break, it's just the lens matter, and viscoelastic dena mere ko. So this is one very important step that I would like to just showcase here. In my left hand, so my right hand is inside, the irrigation goes in, and with the left hand I try to push in the viscoelastic. Cannula fine wala do yaar. So I never leave the chamber collapsing or shallowing. I think this is a very good pearl what Dr. Abhay Vasavada sir has taught us, and I think it works very well for polar, but I routinely practice in all my patients, because this is, actually prevents the chances of इसको clear करो. The CME and most of the complications occurring where you can have a breach. So I do routinely by manual here, and
So Sonu, I had a question about the Geometric Plus. What is the ad for the near?
for the Geometric Plus. So actually the ad remains the same, but it is basically the distribution of light. So for the Geometric Plus, the light distribution is something like 37% for distance and around 37-38% for near, 39% for near, and it's around 10% for intermediate. So it's basically the light distribution which actually helps you to have a very good near vision. And ad is around 3.5, and for intermediate it is around 1.75. So I'm using here the bimanual, and why the advantage of bimanual, if you see here, I can just flip left and right, and the sub-incisional is quite easy to do away. So, sorry, I'm here using the Venturi on the J&J on this Signature Pro. Polisher the mera.
And also, although it was bimanual, you could get out all the cortex.
Yeah.
Getting it out. So most of us do that. So you don't have to swap hands.
So a quick step that I would like to demonstrate here is the polishing here, because once you're dealing with these all premium lenses, you have to be really, optical axis should be absolutely clear. So what I'm doing is I'm snugly sitting on the posterior capsule, and with this sand-blasted polisher, I'm trying to remove all these, the opacities, the lens matter, and very carefully, because this looks very delicate here. The posterior capsule here looks very friable. So I think it is some form of a polar which I don't want to open up, and very carefully I'm just sitting and snugly polishing the posterior capsule and removing most of these opacities along the visual axis. And the posterior zonule, also rightly said by Anurag, looks quite lax.
So you use a sand-blasted coaxial polisher.
So this is a specialized polishing cannula which has irrigation flowing on top, and it is sand-blasted all 360 degrees. So the fluid keeps the AC maintained, and at the same time the sand-blasted can be used to, So, open mat karna, open. So this is what I wanted to, showcase here, and I must congratulate Dr. Partha for launching for the East the Hoya Geometric Plus, and my colleague Dr. Anurag will be demonstrating the Hoya Impress, so which is again a modified. So this is GT4. So this is toric, the T4 model. G is for geometric, and XY, because this again is on the same Hoya Vivenex platform. So this is 23 diopters, and you see here at Somshila, you were talking about this. So intermediate is 1.75, the near is around 3.5, and the cylinder that it corrects is 2.25. So the all, it remains the same, the injector delivery system. So the step 1 here, it is marked here, you see here, it's marked 1 here, and you push in viscoelastic, and this fills, and you just be careful that it goes till the nozzle here. So viscoelastic is the first step. The second step is marked, you just pull this off. So I'm trying to, just pull this off. The third step is where you try to push, where the lens is in the unfolded stage, and if you push this, so the lens starts folding. So I usually visualize it under the microscope to be very, very sure that everything is in place. And the fourth is this, flipping of this. Now, what I actually love with the injector delivery system is this nozzle, which actually can be calibrated. So if you see here, so I can actually shift here. So if I just wanted to do a wound assisted, I would push it further, and so I have this nozzle just protruding, so that this can just go within the wound, and you can have a wound assisted or within the anterior chamber. And if you want to do in the bag, which I would do here, I would just push it back and have a longer nozzle, so which helps me to get the lens in the bag. And this again is with the push and the screw. So this has both the mechanisms, and it depends upon, so this is the screw which gives you a very controlled, and if you're quite comfortable with the shooter kind of system, it again has a very controlled shooting system. So here I'll just show this how I rotate very carefully. You see the this delivery system trying to push the lens. What is very interesting is the reproducibility with this injector delivery system. I think maybe we have done cases from around maybe 5 diopters to almost 32 diopters, and it behaves almost in the same way. So that reproducibility has been a very important factor, and the consistent delivery system. So I think these are, you know, something which is very of paramount importance when you're dealing with these lenses. So this, as I said, paracan डाला, paracan एक drop paracan please. माजी दर्द तो नहीं है, बस wash, flush please.
So the patient had 1.7.
I'll just show the features of the lens here. So as I go in, just watch, I'm trying to use the shooter system here, and you see the sandblasted haptic here. Can you see it? Can you make it out?
Yes, we can see that.
You can see this sandblasted haptic here. So that's
Right.
the beauty which gives you that toric stability.
I think the trailing haptic, I think we may have noticed that it's sandblasted, it's a little different.
Yeah, so I purposefully, you know, held it with this just to demonstrate here the trailing haptic. And so if you closely watch, this is a 6mm lens. Overall it is 13mm, and you have the central 3.2 zone, which has around 4 diffractive refractive areas, and these are the toric markings for the toric alignment. And this is a aspheric lens, and it's built up on the same Hoya Vivinex platform. So that means it is again ozone treated, so that chances of PC are very less. The optics, if you see, these are the square edge optics. So I'll just demonstrate here. The optics are, so these are the square edge optics, and so square edge, glistening free, and the haptics are again sandblasted as I demonstrated. So these are, if you can watch carefully, you can see the sandblasted.
So Sonu, what's the intention of having them sandblasted?
So this sandblasted gives you that, you know, it goes and snugly fits onto the anterior and the posterior capsule. Can you see this sandblasted appearance here?
Yes, we can see that. Yeah.
So this gives you that rotational stability, what, you know, makes this lens very stable in terms of the rotational stability that this lens gives. So irrigation. So all in all, I think wonderful technology that Hoya has given, and I think the initial results of almost 20-25 patients that we have done so far, amazing. 2 of my own school teachers that I have operated, they drive, they do their intermediate activities, they surf the net, and then they are quite a freak on the system as well. So, and they use their mobiles, I think, and we've asked them, you know, for dysphotopsias. So none of these initial patients was complaining of any kind of a positive light में देखना है.
Dr. Sonu Goel, it is an excellent surgery. I think excellent capsulorhexis and phaco and implantation of IOL. I think you have to still align it a little more, no?
So I think I answered your blue light. Dialer.
Thank you, Dr. Sonu Goel, for your excellent surgical skill. Because another case is ready, so we will be moving to the next operation theatre.
So thank you very much, and I am happy to launch this lens here.